Required by law. There is a quorum present to conduct business. We'll begin with a moment of silence. Please join me in a moment of silence. Thank you. Next item is a Pledge of Allegiance. I asked Vice President Mr. George McShann to lead us in the pledge.
Please stand and face the flag. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Please be seated. The first item is approval of minutes. And you have in your packet the minutes from July the 10th, regular board meeting, and July 24th, special board meeting. Give you a few minutes to look over that. I'm sure most of you have already looked over it. Are there any comments? I'll come back and ask Mr. McShann as soon as he gets it back up on the screen. If not, at this time, we'll move on to budget amendments. Mr. Cavazos.
Thank you, Dr. Maldonado, Dr. Flores, board members. Agenda item 6B are the budget amendments for the month of August. We had a total of 4. They're all small and routine. I do want to point out budget amendment number 3. It is to increase cost for $28,200 for a compressor that we need to purchase at Vela Middle School that just went out. That wasn't budgeted, so we will reclassifying some costs. Any questions on that? Thank you.
Thank you. Item D is approval of, C is approval, award of proposals and contracts. Mr. Gracia.
Good evening, Mr. Board President, board members, Dr. Flores. We presented to you on agenda item 6C our recommendations for award of contracts and proposals. We are recommending the lowest responsible bidder meeting specifications, and I'd be happy to answer any questions you all might have.
Are there any questions for Mr. Gracia on the items under award for proposals and contracts? Now we'll move on to the next item. Thank you, Mr. Gracia. Approval of 2012, 2013 PDAS appraisers. Ms. Vargas.
Thank you, Dr. Maldonado, board members, Dr. Flores. We are bringing you forward for your consideration and approval the PDAS appraisers for the school year 2012-2013. These individuals have all received or will receive the appropriate state mandated training to be PDAS appraisers. You will note we do have 4 vacancies at this time, and we will bring those forward at our next board meeting. I'll be glad to answer any questions.
Could you please remind me what PDAS stands for?
Professional Development Appraisal System, and it's our teacher evaluation system.
Thank you. And all our PDAS certified appraisers go through a training process in order to get certified.
That is correct. That's a part of the process necessary for them to be administrators in our school system.
Any questions for Ms. Vargas? If not, then we'll move on to the next item, is approval of out-of-state trip for Harlingen High School South Southern Stars to attend the Disney Performing Arts Workshop in Orlando, Florida on January 18th through the 23rd of 2013. And presenting tonight is Mrs. Sonia Rodriguez.
Motion to approve the consent agenda.
Oh, excuse me, yes, let me back up. We've done with the consent agenda. What's the desire of the board? I did want to come back and ask you if you had any comments on the minutes?
No, fine.
No? Okay. What's the desire of the board on consent agenda?
I move approval of the consent agenda.
Second.
Second. Any further discussion? All those in favor signify by saying aye.
Aye.
Opposed, nay. Thank you, Mr. McShane, for bringing that up. Item 7, you're on.
Good evening, ladies and gentlemen, school board members, administration, and Dr. Flores. I have my Southern Star dance officers here to represent the team, and I also have my executive board back here, here with us today. We are here today to ask for permission and approval to travel out of state. We have picked Florida, and more specifically, Disney World as our trip. We have chosen Disney World because of the opportunities it affords the girls. For example, in addition to experiencing Disney World, all of the girls that it offers, the girls will also attend a Disney dancing workshop that will allow the girls to experience the life of a professional dancer in the fun, upbeat, and positive atmosphere. They begin with a simulated Disney audition taught by a professional Disney dancer, and then it will lead them through a simulated Disney mock show, like if they were actually in a production, professional dancers for Disney. So this opportunity is special because many of the girls will never experience Disney World, nor have the opportunity to learn from professionals who teach Disney dance routines. Educationally, we aim to teach the girls about the history of Disney and Florida. In addition, we anticipate other schools will be there, and it will give the girls an opportunity to interact with students from different parts of the country. Our trip will run from January the 18th, 2013 to January 23rd, 2013. We are requesting the board excuse the girls from 2 days of school. We will leave on January the 18th at 6:20 in the afternoon. It's that early release day after finals. And then we are requesting 2 days, which is the 22nd and 23rd of January. The 21st is Martin Luther King Day, so that it fell into a holiday. So that's why we have a long weekend there. The girls intend to pay for the trip through fundraisers, donations, and personal contributions. The cost is about $1,300 each. We will be taking the team, which consists of 33 girls. We have 6 chaperones, 1 director, and 1 administrator. The trip will be coordinated through a Disney Youth Programs Company out of Disney World. We will be staying in the park at the Disney Contemporary Hotel. Southwest Airlines will be our airline, since they're local and the most direct. We have also, in addition, purchased traveler's insurance in the event something unexpected happens, weather. We respectfully request your approval for this once-in-a-lifetime trip and are here to answer any questions should you have any. Thank you.
Questions from the board?
I move approval.
Second.
Any further discussion? All those in favor say aye.
Aye.
What do y'all think?
Opposed, nay. Bring back some good videos of all
Okay.
all of
Thank
the
you.
performances.
Thank you. Thank you very
You
much.
have a great trip.
Mickey's autograph.
Yes.
Now, I noticed that Mayor Rodriguez didn't stand up when you said you had your team with you. Is he not on the team?
On the team, yeah, leave him behind.
Thank you for visiting us tonight. Next item is approval of out-of-state trip for HHS senior cheerleaders to attend the 2012 Macy's Thanksgiving Day Parade. Presenter Adriana Huerta and Sonia Brandenburg.
Mr. President, Dr. Flores, school board members, and administrative staff, good evening. My name is Adriana Huerta, and I'm here with my JV coach, Sonia Brandenburg. And with me, I have our seniors, Joy Gatherite, Michelle Adams, Bailey Miller, Courtney Rebello, and Emma Manning. Ms. Brandenburg has some pamphlets that we're going to pass out to you. If you have any questions, you can look over that. The senior cheerleaders from Harlingen High School were invited to perform as part of Varsity's group in the Macy's Thanksgiving Day Parade in New York City. Outstanding cheerleaders from UCA include team captains and officers who attended a UCA summer camp. All camp companies are member organizations of Varsity, the largest cheerleading and dance team organization in the world. The total approximate cost of this trip is $2,300 per student. The cost of the trip will cover airfare, ground transportation, meals, and hotel accommodations. The cheerleaders would be staying 6 nights in New York and performing in the famous parade on Thanksgiving Day. The cost of this trip would be paid through a combination of student and parent fundraising monies that these 7 ladies and the coaches would do on their own. The 3 coaches would be traveling with them as chaperones, including our principal, Imelda Munives. We would fly out on Saturday, November the 17th, and return on Friday, November 23rd, missing 2 days of school, Monday and Tuesday before the Thanksgiving holiday. At this time, we are respectfully asking your approval for this out-of-state trip.
There's a motion by Mr. Powers for approval.
Second.
The second by Mrs. Young. All in favor signify by saying aye.
Aye.
Opposed, nay. You got your trip.
Thank you
Have
so
fun.
much.
I forgot to ask, is there a Thanksgiving dinner somewhere in there? I hope.
We hope so, yes.
Very good.
If you want it.
Move on to the next items. Consider to reject all bids for the HVAC upgrades at Bottom Elementary, Gutierrez Middle School, and Harlingen High School South, CNST 0512-01. Mr. Gracia.
Yes, again, Mr. Board President, board members, Dr. Flores. This particular bid was done back in the latter part of May, and it was tied to a Cool Schools grant that we had applied for. Kind of a fast-paced project. We were supposed to have been given notification in June whether we got awarded the monies or not, and we did not, but we still went through with the process. Given the fact that we did not get the grant, then our recommendation would be to reject all bids that we received for that, so that we can go ahead and put this one to rest.
The reason for the rejection is we did not get the project funded.
That's correct, sir.
So desire of the board?
Make approval for recommendation as recommended administration.
Is there a second?
Second.
Further discussion?
Just wanted to ask Mr. Gracia, in terms of, I guess we can put off those HVAC upgrades, or are we doing it already?
Well, those are future projects that we have in line to do. We have a couple of units that are going to be needing replacement. But due to the payback on those particular units, we said, well, let's get them on a schedule. And a particular concern would be the one at Bonham. We still have a couple of years of life on that unit. So in the future, we will be looking to replace those.
It was a wish list, but based on the fact that we didn't get the grant, then of course, then we're taking it off the table now
Right.
because we can actually forego that another year or two or whatever.
That's correct. We had looked at it from a financial situation and said, well, if the payback is adequate, we might even look at moving forward with this, but the payback was way too far out there for us to consider the monetary consideration in lieu of holding off and extracting those last years of life out of these units.
But I just want to make sure that everybody knows that structurally we're okay there. If
Absolutely.
everything's fine, we can wait, but, so it's something that was a wish list, but we can do that at a later time. Thank you.
Any further questions? Not this motion is in second. What's the desire of the board? I'm sorry, all those in favor signify by saying aye.
Aye.
Opposed, nay. Thank you, Mr. Gressa. I'm a little off tonight. Next item is approval of the charge to the 9th grade Academy Identity Committee. Dr. Arturo Casas.
Dr. Maldonado, chairperson, board members, Dr. Flores, and administrative staff and audience, we bring for your consideration approval of the 9th grade Campus Identity Committee, beginning on page 41. You see the charge put forth to this identity committee. We have brought this forward for review through the facility committee meeting. It calls for 3 principals, 3 parents, 4 teachers, 4 students, 1 DEIC member, the athletic coordinators from each school, the athletic director, and an alternate for all those positions as directed by Board Policy CW Local. The charge for this committee, as we have done in the past, they will begin to identify alternatives for mascot and color for the 9th grade academy. The timeline calls to bring forth that consideration for the November board meeting with the recommendation for the name of the campus to be brought to the January board meeting of 2013. That, keeping in mind, we have brought forth on several occasions the policy CW local that drives this decision. We remind the committee members, once assembled, that their charge is simply to bring forward viable options and alternatives to the Board of Trustees. We have put this on this timeline with the anticipation of opening August 2013. So we bring this after a lengthy discussion at several meetings for your approval. The charge is there on page 40 and 41, and I'm prepared to answer any questions that you may have.
Are there any questions for Dr. Goss on the charge?
I move approval.
I'll second.
Moved and seconded for approval. Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, nay. Motion carries. Thank you. Next item is approval of memorandum of understanding with the Cameron County Juvenile Justice Alternative Education Program to provide educational services to high school students under probationary supervision. Dr. Cavazos.
Yes, Dr. Maldonado, board members, administrative staff, and audience, this is a routine approval. We have a current agreement with Cameron County Juvenile Justice Alternative Education Program to provide juvenile probation officers at each one of our comprehensive high schools. We pay for partial or half of their salary. They are an added value to our administrative staff there, and their sole responsibility is to monitor the progress of any students who may be under probation during the school year 12-13. And so we recommend approval. There are no changes from last year's memorandum.
To the desire of the board.
I move for approval.
Second.
Second, further discussion. All those in favor say aye.
Aye.
Those opposed, nay. Motion carries. Next item is approval of memorandum of understanding for resource officers. Again, Dr. Cavazos.
Yes, Dr. Maldonado, board members, Dr. Flores, and administrative staff and audience, we bring for your consideration the memorandum of understanding with the city of Harlingen for their services to provide school resource officers to our comprehensive high schools. As you know, our agreement calls for them to provide 1 full-time officer at each high school and 1 alternative officer on an off-duty basis for each one of the high schools, for a total of 2 officers. This is only partial of our security efforts there at the high schools. We also have security guards, and we have, for your consideration, also our camera systems and so forth. We bring for your consideration approval of this memorandum. We have spoken to the chief and the sergeant, and they are taking it forward for approval to the city commission meeting on Wednesday. And so barring any issues, we should be right on target for the beginning of the school year. And so we are recommending approval to continue this relationship with the city of Harlingen.
I recommend approval of this particular item.
There's a second?
Second.
Any further discussion? There being none, all those in favor of the approval of the memorandum of understanding for resource officers say aye.
Aye.
Opposed, nay. Motion carries. Next is approval of revision to board policy BDB local and DEA local on second reading. Ms. Vargas?
Thank you, Dr. Maldonado, board members, Dr. Flores. We bring for your consideration and approval the revision to board policy BDB local and DEA local on second reading. Both these policies were discussed in a policy committee meeting, and I believe Mr. Powers chaired that day. We did incorporate some recommendations in changing, if you look at page 56, the Employee Benefits Committee will now be the Benefits and Organizational Development Committee. And on DEA local, we were aligning our practice and our policy and making our work week Friday through Thursday. I'll be glad to answer any questions, or Mr. Powers may have some additional information.
Mr. Powers, do you have any further comments?
I think she's covered everything.
Was that a motion for approval?
I move for approval.
I'll second.
Further discussion? All those in favor signify by saying aye.
Aye.
Opposed, nay. Next item is approval of travel reimbursement rates for 2012-2013. Mr. Costas.
Thank you, Dr. Maldonado, Dr. Flores, board members. Agenda item 14 is approval of travel reimbursement rates. We bring forward to the board annually this agenda item. We currently follow the state of Texas reimbursement rate with the exception of the per diem rates. Our per diem rates that we're recommending are for breakfast $9, lunch $16, and dinner $22. No change from last year, but that is our recommendation as we're required to bring forward. Any questions?
I move approval.
Second.
Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, nay. Motion carries. Next item is approval of workers' compensation insurance for 2012-2013. Mr. Costas.
Thank you, Dr. Maldonado, Dr. Flores, board members. Agenda item 15 is approve workers' compensation insurance for 2012-2013. We discussed this in detail at our July 10th Employee Benefit Committee meeting. This is the second year of a no rate increase proposed by TASP, our current carrier. They proposed this no rate increase last year. We are pleased with TASP. We've had them for several years. Actually, we're doing real well in our self-funded insurance with TASP. We spend annually about $500,000 for this service. Again, we do have some services that they provide, such as safety training that on an annual basis. We're pleased with their services as well. So any questions on that?
Mr. Costas, I have a question on the balance sheet dated August 31st of 2011. Under workers' compensation, we show an unreserved fund balance. I mean, it's about equal to the set-aside for estimated cost of open claims.
Correct.
That unreserved balance is separate from our total fund balance, or is that included?
That is correct, separate. This is like I said, a self-funded insurance plan that is unreserved for this particular fund. So it is separate from the $32 million that we have in our general fund balance.
So it is, would you consider that an encumbered fund for this specific purpose?
It is unencumbered for workers' compensation premiums for future years in case if something does happen. The board can take action to remove those funds out at any given time.
Okay. What's the desire of the board?
Make a motion for approval.
Is there a second?
Second it.
Any further discussion? All those in favor of the approval of the workers' compensation insurance for 2012-2013 signify by saying aye.
Aye.
Opposed, nay. Motion carries. Next item is consideration and approval of health insurance for 2012-2013. Mr. Costas.
Thank you, Dr. Mao, Dr. Flores, board members. Agenda item 16 is consideration and approval of health insurance for 2012-2013. We had an employee benefit committee meeting earlier this afternoon. We have Scott Gibbs from our consulting firm of McGriff Seibel. He is here to give a presentation of the proposals that we received. We did receive a total of 4 different proposals, and Scott's going to go over the proposals and our recommendation to the board. You should have this packet in front of you as well. This is what Scott's going to go over.
75, right? Page
Sorry.
75?
On the agenda?
Yeah, in our packet.
74?
Thank you. Yeah, you do have a copy of the proposals that we received, and Scott's going to go over the detail of those proposals. We had a well-attended committee meeting earlier this afternoon, and we discussed a lot of these issues, so that's it right.
Mr. Gibbs?
Dr. Maldonado, board members, Dr. Flores, thank you for having me here tonight. As Mr. Cavazos said, we had a board meeting today, a committee meeting today, went through this information. I'll present it to you tonight, and if you have any questions, please feel free to stop me or ask me at any point. The first item is just kind of the overview of the process. We did submit an RFP for competitive sealed proposals to provide managed health benefits. That RFP was released on May 20th, 2012. We did have a deadline set of June 19th, 2012 for responses. We did receive multiple responses. Copies were forwarded to me for review. On July 10th, we had an initial presentation to the Benefits Committee. Then we had some further negotiations with Valley Baptist Health Plans. And then on August 14th, I'm here tonight to present the results. Looking at the fully insured medical analysis, as you've probably read, the fully insured market has shrunk in the number of carriers that are out there. We do in the Valley, you have Aetna, Blue Cross, Cigna, Humana, United Healthcare, and Valley Baptist that do provide fully insured medical plans. Of those 6, we had 3 decline to quote due to competitive reasons, and then we did receive 3 quotes, one from Blue Cross, one from United Healthcare, and then from the incumbent Valley Baptist Health Plans. Looking at the fully insured quotes, Valley Baptist Health Plans did provide 3 competitive options. The Blue Cross Blue Shield was the next competitive. However, it was not really even close to being competitive to what the options were from Valley Health Plans. And then United Healthcare was the most uncompetitive. They came in representing about an 11.38% increase. Valley Health Plans, looking at the options. Yes, sir.
Your ranking of competitive is based on dollar amount or package?
Based on plan designs, dollar amounts, and I'll talk a little bit about that as we go on with the presentation. The 3 options proposed by Valley Health Plans, option 1 was keeping the same plans in place. However, they did actually increase the current benefit levels. A couple of years ago, the deductibles and the out-of-pocket maximums, in an effort to keep the renewal at a rate pass, were adjusted up. With this proposal, option 1, it would actually decrease the deductibles for employees and families and actually decrease the out-of-pocket maximums. I'll show a little more detail on that in a minute. That would also, the rate would decrease by 10% in option 1. Option 2, Valley Health Plans was recommending converting to the current PPO plans to their new certificate of coverages, but with that certificate of coverage, the pharmacy benefit would change pretty drastically. We would go from an open prescription drug formulary to a closed prescription drug formulary, and we would have a Tier 4 copay. I'll talk a little bit about that on my next slide. That did represent a minus 13.24% decrease. Option 3 would be moving from our current PPO plans to HMO plans, which does give us a 20% decrease. However, I'll talk a little bit about those differentials. So currently, as we exist today with option 1, we have 2 PPO plans, a high and a low PPO plan. Looking at going from option 1, which would be keeping our existing plans except getting richer deductibles, to go to option 2 and get an additional 3.24% in savings, we would implement what's called a closed formulary. Basically, right now, we have a formulary list, which is a preferred drug list with Valley Baptist. If a drug does not appear on that list, it is charged at the 3rd tier copay of $60. However, If we moved to the option 2 drug plan, we would have what's called a closed formulary, and then any drugs that are not on that list would not be eligible for the Tier 3 copay. The member would be responsible for the entire cost of that prescription drug. The current disruption is roughly about 493 members, or about 4% of the population. Also on the proposed drug plan for option 2, they would implement a Tier 4 drug copay. Tier 4 drugs would be specialty pharmaceuticals that tend to be high-dollar pharmaceuticals. Currently, those drugs are covered at the 3rd tier, which is the $60 copay. They would move to a 4th tier now, and there would be no copay. The member would be responsible for 20% coinsurance up to a $4,000 out-of-pocket maximum. That's a pretty significant. That's a pretty significant plan change, especially if you have some individuals that are taking like a $1,000 drug a month. Instead of $60, it would go. They pay 20% of the $1,000, which would go to $2,000. We would have about 33 members impacted. And again, the difference between option 1 and option 2 is a decrease of about 3.24%. Looking at the difference between our current plans and option 3 would be moving our current PPO plans back to an HMO plan with Valley Health plans. The network match is roughly about 98% in the Valley. The one additional negative is currently right now in the PPO environment, members can self-refer to specialist or specialty facilities outside of the Harlingen area, such as MD Anderson and other facilities like that. If there are procedures that are done in the Valley or services provided in the Valley, if a member wanted to go to a facility outside of the Valley, they would have to get prior authorization to do that from Valley Health Plans. Also, with the moving to the HMO, we would be subject to the closed formulary and the Tier 4 prescription drug plans. This slide shows you the Valley Health Plan renewal with our current plan. This would be option 1, just the renewal. You can see that under this plan I've highlighted in yellow the areas that are improved benefit for the employees and the members. Again, the individual deductible would go on the high plan from $625 for an employee and $1,250 for a family, back to $500 for an employee and $1,000 for a family. On the low plan, it would go from $1,125 for an individual and $2,250 from a family, back to $1,000, $2,000. The out-of-pocket maximums would decrease back to $1,000, $2,000, and $2,000, $4,000 as well, and we would realize a reduction of 10% for the plan year. And that's roughly a savings of between 1.1 and 1.2 million. And I have those numbers towards the end of the presentation. This would be option 2. Again, I've highlighted in yellow the areas that are improved benefits, and in red are the areas that would be a benefit reduction. So the changes here would be that the ER copay currently is 90% with the deductible waived. Under the new plan, it would be a 90%. For the high plan, it would be 90% after deductible for emergency room and 80% after deductible for the low plan. And again, you can see in red, this would have the Tier 4 drug and the closed formulary. It represents about 13.24% or a little over 1.5 million in savings. The Plan 3 option, as presented by Valley Health Plans, again in yellow you can see the increased benefit, in red the decreased benefit, and really the main difference is we would move to the HMO platform versus the PPO platform, again with some limitations regarding specialists and specialty facilities outside of the network area. But that savings would represent about 20% on an annual basis. Also, as part of the analysis, we did take a look at partially self-funding. Currently, we're under a fully insured contract with Valley Baptist. What that means is, on a monthly basis, we pay a flat premium to Valley Baptist for our members, and then no matter where our claims fall, that premium, pays for those claims. That premium includes administrative cost and everything. So, if our claims run much lower than that premium, Valley Baptist gets to keep the difference. If we run over that premium, Valley Baptist would still pay those claims, so it's a fully insured premium. What happens on the partially self-funded, in the partially self-funded arena is we would contract with a carrier like Valley Health Plans or Blue Cross and Blue Shield or a third-party administrator. We would set up a bank account. They would administer and pay our claims for us, but we would pay our claims through that bank account on a weekly basis. So instead of paying the upfront premium, we would fund our claims as they go. Most of my large employer groups are self-funded, just because on a group your size, you are a fully credible group, meaning that when we look at your claims tend to be pretty steady. So what we've done in the last couple times I've presented to you as well is I've looked at the pros and cons of whether fully insured or self-funded is the right way to go. Having looked at it again this year, we did include that as an option in the RFP, and we received a quote from Blue Cross Blue Shield, from Meritain, which is a third-party administrator owned by Aetna, from United Healthcare, and from Valley Baptist Health Plans. Looking at the cost this year, what I've got here is we've got a total fixed cost. In the self-funded world, what the fixed cost would be is those are the costs you're going to pay on a monthly basis. They're going to be to the third-party administrator or the carrier to administer your claims and pay your claims. They're also going to include fees for reinsurance. What reinsurance is it's insurance to protect the district. Since you're funding those claims as they come in, it provides you with insurance against large claims that would hit the plan. So what we looked at in this example was we set the specific deductible at $125,000. So it means that the district would be would pay the claim up to $125,000. Then any claims above $125,000 would be sent to reinsurance and would be reimbursed. As well, we would recommend you purchase, if we went self-funded, you would have what we call aggregate insurance. What the aggregate insurance does is it gives you protection on all of your claims as a whole group. And usually what happens is we set that limit is at 25% above the expected claim cost. So those would be, and again, those are the three facets you would pay for, and your fixed cost would be your administration, your specific stop loss, and your aggregate stop loss. So you can see that your fixed costs are really a small portion of the total cost. Really, the bulk of your cost is going to be in your medical claims and your prescription claims. That being said, looking at all of these options, whether it's Valley Health Plans, Blue Cross Blue Shield, Meritain, or United Healthcare, looking at what we would expect the claims to be, it is more beneficial for you to remain fully insured through Valley Health Plans than to look at going partially self-funded at this time. But it's a scenario we wanted to let you know that we looked at so that we were covering all the bases.
Mr. Gibbs, when you're comparing, based on your last statement, in comparing the Valley Health Plans option that you're basing your statement on and Blue Cross Blue Shield as a self-funded cost, there's still a negative, there's a negative 6.3% based on where we are today, cost-wise. What about coverage in comparison to what Valley Health Plans is proposing on a fully insured plan and the self-insured
right,
plan?
Currently, the proposal that Valley Health Plans has on the, if we kept the like plans, the option one, that's a reduction of 10%. So it's roughly about 10.4 million versus Blue Cross, it would be at 10.8 million.
Okay, and that's already factoring the differences in the benefits.
Well, I would actually, that does not have the factor in the benefits. Blue Cross is actually providing a quote based on those current deductibles and out-of-pocket maximums. So this would probably actually even be a little bit more elevated than where we are with the proposed renewal for Valley Health Plans, because they did lower those deductibles, which is a richer benefit.
So the 10.8 would be more elevated.
The 6.29 would probably be reduced to, you know, with those benefit differentials, 3 to 4%. So it would
Okay.
probably, that 6.29 would probably be closer to 2 or 3%.
Yeah, thank you.
So, you bet. So that being said, with the self-funded basis, it looks like there's a greater savings potential by staying fully insured. When you look at the self-funding again, you know, you're going to fund the claims as they go, whereas right now you have a true fixed opportunity by staying fully insured for greater savings. Again, there's no multi-year rate guarantees for stop loss when partially self-funded. So the recommendation that we've talked to the committee about would be to remain fully insured. So looking at the total cost analysis, where we are today with Valley Health Plans is we're roughly at about $11.6 million in total premium. Looking at the renewal, with the increase in benefits, keeping everything the same prescription drug plan, we would reduce our annual cost to about $10,453,000. And that's a savings of about $1,161,000. Option 2, which has the much more stringent pharmacy, is a reduction of 13.24%, or about $1.5 million. And then looking at the HMO, would have an annual cost of about $9.3 million, which represents about a $2.3 million savings. Again, it's going to be less flexible than what you currently have with the current plan. So looking at that, when we discussed with the committee today, the recommendation would be to remain fully insured with Valley Baptist Health Plan. We would recommend renewing with the current plan at the 10% decrease with the increased benefits for 1 year. It's the least amount of disruption to the employee population. The prescription plan changes would affect roughly 4% of the population, and again, for those people that would fall under the Tier 4 drug, it would be a very significant change for them. And then also, the HMO would limit utilization of specialists and specialty facilities outside of the Valley. So again, it would limit your employees from really having that self-referral piece. I'd be glad to answer any questions regarding the presentation.
Any questions from the board?
Okay, Mr. McShann chaired the Employee Benefit Committee. I don't know, Mr. McShann, if you would like to elaborate anything on.
Yes, thank you, Mr. Cavazos. Dr. Maldonado, board members, we had the Employee Benefits Committee meeting this afternoon, and attending the meeting, Ms. Verna Young, Ms. Jerry Fleury, and Dr. Nolan Pettis, as well as our advisory committee and staff. One of the things I would like to say is that the Affordable Care Act that was, signed into law and also approved by the Supreme Court allows fully insured carriers, if you're fully insured, to participate in an 85% rule of the medical loss ratio. The Harlingen CISD had a 76.5% medical loss ratio, meaning then that you would get additional refund, if you will, a rebate for this. And the rebate we got was $979,000 to the district. Of that amount, $157,000 would be rebated to employees who participated in the insurance policy, and another $822,000 back to the district. That's something we didn't know, and we got that because we were fully insured. And we'll be eligible later this year, if we remain under the 85%, perhaps to get something very similar to $1 million. I just thought I would share that. That check is here. I think, Mr. Cavazos, you have it in hand, right?
Yes, sir. We deposited last week when we received it.
I have a. But that, how is that having a bearing on what we're talking about tonight? That's
a benefit for the benefit committee, just to inform the public that the district through Valley Health Plan, following the Affordable Care Act policy that's in place, that we had 76.5% medical loss ratio, therefore we were awarded that, okay? If you were self-insured, you were not eligible. There are districts in the valley who were self-insured that they would not qualify, be eligible to receive funding from the Affordable Care Act, okay? I just want to inform the public that that is something that that we did receive, and that's $822,000 we'll have that we did not anticipate. The committee asked Mr. Gibbs a lot of questions, and as a result of that, we were able to, I think, get clarity on what the benefits are that's being recommended. We know that there are issues that we need to address, and we will be doing that. However, based on the data we have, we would recommend, I would recommend approval of the health insurance to Valley Health Plan using the, I guess it's option 1 for the 2012-13 school year. That's my motion.
There's a motion on the table to accept the recommendation of the consultant on going with accepting Valley Baptist Health Plan's renewal at, is it the high PPO? Which one is it that we're taking action on?
It would be the, it would be option 1, which would be the high PPO, low PPO, at the, with the increased benefits at the minus 10%.
And I might add that it's about $1.1 million less than the current insurance costs.
Is there a second?
I second the motion.
Yeah, Mr. Gibbs, from a bond rating standpoint, when this came up last, I don't know, 3 years ago, Valley Baptist was at a C bond rating. And can you tell us what the bond rating is for Valley Baptist Health Plans? Was that a C bond rating?
Right.
Can you tell us where they are today in that bond rating?
They've been purchased by Vanguard. What's
Our insurance company by AM Best.
I'm sorry, could you identify yourself?
Good evening. I'm Sherry Griffin. I'm Senior Vice President of Managed Care for Valley Baptist Health System and President of Valley Baptist Insurance Company. And our company right now is rated by AM Best, which is the rating agencies for insurance company, at a B. And we currently have it open. It's for review. For the last 2 years, we've got improved performance reviews on that, and we're anticipating the new rating to come out from AM Best anytime now. In addition to that, we've raised our reserves through our partnership with Vanguard and our improved operating performance to 3 times what the state of Texas requires. So our risk-based, what they call risk-based capital, is more than adequate. And what that would mean is if Valley Baptist closed its door, insurance companies closed its doors tomorrow, that we would be in a position, we have enough cash to be able to pay our claims 3 times over.
And what, how many members total does the Valley Baptist Health Plans insure today?
Today, we're right at around 15,000 and change, 15,007. We just signed a new group in Hidalgo County, and that number does not include that group, which is the City of Edinburgh, for the fall, and that does not include our increased membership that we're picking up through teacher retirement, TRS, active teachers, for the fall as well, that we have. So
that would be over and above the approximate 15,000?
It would, sir.
Okay. Any other questions?
Well, just for the sake of discussion, we're in discussion.
Yes.
You know, I was there in attendance at the committee meeting, and obviously I was very engaged in the discussion as well. And you know, there was a lot of issues. You know, as as a physician in the community, and I'll disclose that, this represents a very small percent of my patients that I see in my practice, by the way, but so I don't have a conflict in this issue, but what I want to say is that we hear things. And the concerns that we had, we talked about them, we vetted these issues. I don't think you were there, Sherry, today. I didn't see you there.
We were actually in the building. We were down on a conference call trying to make sure that everything was in place for Mr. Gibbs here.
Well, that's fine. You were well represented, but let me just tell you that some of the issues, just to get these on the record and for the community to know, and for the board to know, so we can see that these things are addressed, because we're here in our first and foremost interest as the students, and of course our staff are a very important part of taking care of our students. We want to make sure that they're getting the services that they need in terms of, and health insurance is very important.
Right.
So we hear a lot of things. Several issues were discussed at the committee meeting. First of all, the pharmacy issues. The fact that we use a pharmacy benefit manager, and the Scott and White, I believe, is the agency that you guys use.
That's correct.
There's a potential in terms of, there's a lot of sort of money that we're paying out to sort of this middleman, so to speak, that aren't necessarily, so we're sort of losing out on that situation as well. So I think in the future, we ought to look as a board to being self-funded, at least look at it, and the staff, Scott, you mentioned that that's something you would work with staff to see if that's a viable option in the future to becoming self-funded. Can you mention again for the audience and for the board, what % of your clients are self-funded in terms of comparing apples to apples, entities our size?
Yeah, we work with about 35, out of the Dallas office, I work with about 35 different municipalities throughout the state. And, I would say 75% of mine are partially self-funded. And from, most of them it makes sense. And like I said, in this situation, we tracked it, we looked at it for next year. It did not look like it made sense, but it's something that we've looked at. Mr. Cavazos, I've worked with you guys for about 6 years, and we've looked at it on a couple of different occasions. And I think it's something just as good stewards to continue to do and make sure that from a funding mechanism standpoint that you're getting the biggest bang for your buck.
Right, and so, I think the benefit there is, we have a large organization where the risk is sort of, spread across. We can obviously have a situation where we mitigate that risk even further by, having an insurance company serve as a TPA to manage those claims, number one. Number two, have reinsurance for a risk, let's say, per member above a certain amount. Of course, experts would decide what that amount was, and then, of course, have aggregate reinsurance for even above a certain amount, however many $1 million. So that would even mitigate our risk even further. And I think that that's something that we all can look at on a go-forward basis. And I certainly would want to know from staff down the road if that makes sense, if and when for the future. So just to say that. But in discussing all the issues, some other issues came up with not only the PBM issue, the local pharmacies making sure that they're getting their due compensation. Scott mentioned that a lot of that is contract issues, how they contract with Scott and White, and that kind of stuff. And so a lot of that's out of our hands, understandably. But we sort of, wanted to make sure that those professionals were getting compensated. I'm sorry, Sherry, go ahead. You have a comment.
I was just going to speak to that a moment, and you make an excellent point. There's a new program that was rolled out in our area that's not been typically in our area, and from my information, Doctor, most of the impact to the pharmacies have been through that program. And what that is, that's not a Valley Baptist Insurance Company program, that's the Managed Medicaid program. And prior to that program being rolled out, my understanding is there was a considerable higher amount for adjudicating a script that the pharmacists were able to get on that particular population. And since the state has chosen to roll it to Managed Medicaid, again, Valley Baptist Insurance Company does not handle any Managed Medicaid, then the Managed Medicaid companies have turned around with the concurrence of the state in order to cut costs. We all understand the challenges that our state have, and we have so many good servants at that level, but still it's a challenge. And as a result of that, they brought some of those that compensation down for those particular scripts. But in particular, on our population for commercial, we pay what's been being paid for many years now since we've been with Scott and White and even prior to that. So it's comparable in the market to what it's been historically. So I don't know if that clarifies or not, but.
That helps. That helps. I appreciate that. You know, so the other issues, aside from the pharmacy issues in terms of the PBM and the local folks, I mean, there, you know, there's a lot of obviously, you know, things in flux, and that happens obviously with the purchase by Vanguard and everything else. There's just a lot of things in flux. I mean, we know that there's been a change at the, used to have a different TPA. Now you're managing your own claims, I guess, with your new situation, but it used to be First Care. So that's sort of been a change in terms of how the claims are being managed. And then secondly is the sort of the medical person, the CMO who approves a lot of the different tests or referrals or DME or prescriptions, or, you know, all those kinds of things has recently been changed as well. That may or may not know a lot of the doctors and a lot of the pharmacists and a lot of the professionals and the providers in the Cameron County and Harlingen area. So there was some concerns. They were addressed as well.
Okay.
And then
I would also add, Doctor, to that as well. We take very seriously our commitment to our members, to our employers, to our physicians and our hospitals. We are provider sponsored. We are sponsored by a local health system that's been in this community, 100 years or so. So we take that very seriously. We do independent audits on that as well. We just got our Myers audit back on that, and we performed much higher than historically and have improved that, as well as we compare to industry, much higher than our industry comparison across all facets of that. But we'll be glad to share that with the committee at some point in time in the future. So we do monitor that and take very seriously our obligation to all those constituencies to bring that together for the best benefit for quality services for your employees when they were to need those services.
Well, again, the commitment from the representatives at the meeting, you can tell was there to work through some of these issues. The last thing was about the out-of-town care. There's been some sort of, you know, occasionally, and please understand for you and for the audience and for the board members, and this is a statement I made in the committee meeting, it's hard to know sometimes when you hear things in the community. You know, it's hard to know whether you're hearing the tip of the iceberg or the squeaky wheel. It's difficult to ascertain that, in all honesty, because you know, you don't know if this is sort of a bigger you know, issue underlies this, or it's just sort of these random deals, you know, because you're a board member kind of a deal. And so that's why you get it out there, you let staff and you let everybody discuss it and kind of figure out, you know, where can we make these improvements for the benefit of our you know, of our members in the school district. But the out-of-town issue was something that I brought up because, you know, we you know, our members travel a lot, and we want to make sure they're getting the care they need when they go off. Obviously, the one issue that's going to impact is the out-of-town referrals. But obviously, when there's emergencies or other care issues arise, urgent care issues arise, these things will be covered. And it sounded like that was not an issue. Is that correct?
No, that is not an issue. The plan we would be approving would be the same plan, and members can access any of the providers that are in network throughout the nation.
So it's important to note that we not only have a regional network, but we have a statewide network as well as a national network. So we are covered coast to coast.
And so while I initially stated that I think that we ought to, staff ought to in the future perhaps look at a self-funded model with carving out of the pharmacy so that we don't have to sort of shell out all this money to a PBM middleman, so to speak. I think there'll be some potential savings there. Again, that's for staff and for our consultant to sort of vet for the future. It seems to me with the $1.161 million savings, I mean, it's just sort of too good an offer to pass up. Plus the $822,000 or whatever. And can you clarify that, Scott? Is that only because we're remaining fully funded? Is that correct?
No.
Well, no, the rebates apply. Part of the Affordable Care Act was that the carriers have to maintain, they have to report their medical loss ratios. For large groups, it is, and large groups is 100 or more, is the 85%. So basically the loss ratio is 85%, meaning that the carriers have 15%. You know, 15, and a loss ratio is simply your claims divided by your premium paid, and so that means that the carriers would have 15% to play with. On the small group, it's 80/20. And so basically they have to report their MLR across their book of business, and depending on where their MLR falls, it would they would necessitate a rebate to each of the groups, and then the rebate is actually paid to the group, and then the group has to, depending on how the assets were funded, whether it's in a trust asset or not, then that portion's given back to the employee via cash or premium reduction or benefit differential. So.
And so the total benefit is 1.98 million total with both the rebate plus the difference in the
rebate and the savings is, I mean, you're roughly in the $2 million ballpark.
Okay.
Yes, sir.
I'm sorry.
So just for clarification on that, does the number include the rebate is going to affect all the carriers of the size we're talking about?
No, sir, not necessarily. The med-loss rebate is based on a block of business. You happen to be in the large block of Valley Baptist Insurance Company's business. That block came in under budget, and because of the savings on your previous plan year, the one 2011, that would have ended 2011. So that was the check that was delivered to the school district. And then the savings and the 10% reduction is on a go-forward basis for your next plan year.
So if Washington changes legislation, is that going to affect our number?
It could affect, I mean, the MLR, as the way the law is written, is that's done on an annual basis now. So if the plan and Valley Health Plan's book of business runs like it did this year, then there would be, another check. Now, what happens in Washington could always change if, if the winds of change sweep a new president in,
Yeah, let me rephrase that. If the current law stays, do the numbers presented today reflect the benefit gained from the current legislation with the Affordable Care Act?
Yeah, these numbers have, these numbers would make you comply with the Affordable Care Act. And again, this is on the health plan. The MLR rebate is completely something separate.
The rebate is for the calendar year ended December 2011. So it's for that calendar year. Regardless of who we would go forward, we still get that rebate. Now, we could get another rebate for calendar year 2012, depending on our medical loss ratio. But it's really for the $979,000 that we received was for that calendar year 2012.
We've been with Valley Health Plans 9 years.
Approximately, yes. It's been.
So we have a pretty good history. We've got almost a decade of history, what our losses have been.
Mm-hmm.
And I know we don't have a crystal ball, but the question I'm asking is, does the reduction of, I think it's the savings of $1 million include the rebate that's mandated by the federal government?
No, sir. The million is completely separate than the $900,000 that you got in the rebate.
Okay. Now, how many? Do we have an idea of how many of the out of area referrals? And I'm not talking about incidents that happened outside the area, but out of area referrals have been denied over the past couple of years, 3 years, the last renewal.
Sir, you're currently in a PPO plan, and in a PPO plan, PPO members can go where they would choose to go. There's no gatekeeper, there's no restriction. They can go to any in-network PPO provider regionally, statewide, or nationally.
Now, I have been with small companies and large companies, and and I understand the equation changes depending on what legislation is going on, and the insurance industry, it's a lot different today than it was 10 years ago. But I've always found that there was a value in agents. Agents were specialists in the insurance business, and we did have loss control people internally in manufacturing companies doing some of the lower level safety reviews and audits. why is a plan like ours, why would it not benefit from an agent's participation?
No, and I think it's important, you know, I act as an agent for some clients, I act as a consultant, I have my consulting license. So I do think it's beneficial to have someone, whether it's, you know, to have someone on a retainer basis, following claims data, looking at things, you know, things of that nature. With usually in the past, you know, you guys have engaged me to do the RFP process and you know, look at the self-funding, you know, at that point. But I do, with most of, you know, my clients, you know, I am on an annual basis, and we track and look at the claims. I have a reporting staff back in my office. We look at, you know, diagnoses coming in to see if there's things we can do better with the wellness program or disease management programs and things of that nature. So I do think you could benefit, whether it's me or whether it's one of my colleagues. I do definitely think it's beneficial to have someone on an annual basis that can meet with the insurance committee, an external consultant to meet with the insurance committee on a quarterly basis, just to kind of kick the tires and take a look at everything and track your claims and let you know how things are doing.
But, Mr. President, but I guess in terms of the, I mean, obviously, if we're fully insured, are you an agent with districts that are fully insured as well?
I am. You know, I have clients that are fully insured or self-funded. My arrangement, you know, I would probably tell you, probably 65% of my clients I'm on a fee basis with. 35% want me to take commissions. Commissions are fully disclosed on an annual basis. They know exactly what I make, and nothing's, you know, that's negotiated up front.
And so I guess another question is, in terms of, it would seem to me, maybe I'm wrong, it would seem to me that there would be a little bit more of a benefit in having an agent if we're self-funded. Is that not correct?
No, I think it's definitely, I think when you go self-funded, you definitely need a consultant, because also too, reports are a little bit, in the fully insured world, the reports that you're provided by the carriers are a little more limited than they are in the self-funded world. In the self-funded world, for my large clients that are self-funded, I have access to all the carriers' reporting systems. My guys can go in, download the data, you know, real time. You know, usually every 15th to the 20th, the claims are updated for the prior month's claims. And in a self-funded environment, that is very, very important.
Right. And regardless of who your TPA is, you still have an agent helping and working the claims. Absolutely. And helping and making sure that everything's running smoothly.
Absolutely.
Do you think we're at a deficit now without having an agent? In terms of what your experience with this district, obviously you come on intermittently as a to help doing the RFP. Or right now are our members at a deficit necessarily, but by us not having an agent?
I wouldn't say you're at a deficit. I think you know, the fully insured world, it's you work the renewal and the pieces, and it's not, you know, when you move to a self-funded arena, there's ultimate flexibility, and I wouldn't say you're at a detriment. I do think you could. I do think it would be beneficial to look at that. I think you know, from an outside consultant's perspective, you know, we have a lot of clients. We provide a lot of benchmarking data for our clients with other school districts, other municipalities throughout the state, from a compliance standpoint with PPACA and with the all the items that you're going to have to address over the next, you know, year to 2 years, and then who knows what happens in Washington. I mean, I think it, you know, I think it could be beneficial for you. I don't think you're at a detriment right now, but I think it could be beneficial to you and the benefits committee.
Mr. President,
Mr.
I have a couple of questions. I guess there are two follow-ups. One from President Dr. Maldonado is when he asked about the tracking or the data on individuals that are requesting assistance outside of the Valley. I guess maybe a different question is maybe the definition of emergency, because you go to a doctor and maybe it's an emergency to you, but it's not an emergency in the definition of it being, I guess, approved. I mean, is there a definition that what follows of an emergency circumstances or situations?
Yes.
I was going to say, in the state of Texas, usually what we have is called prudent layperson. And most, all carriers adhere to prudent layperson. So if someone truly shows up in the emergency room and they think it's an emergent situation, the carriers are going to pay the claim. I've yet to see a carrier deny an ER claim when a
Okay,
person
and I guess let me add that, because obviously if you go to the emergency room, it's probably an emergency.
Right.
But let's say someone has they break a tooth and it's and there's no way that they can function. Would that be considered an emergency?
If they probably not if they broke I would say if they broke the tooth in an automobile accident, and then were carted into the emergency room, that would be an emergency. But if they broke their tooth, that's not going to be considered.
Or if they had a high fever and had to go to the doctor?
High fever would definitely be an emergency if they showed up in the ER and they were spiking a 104, 105 fever and they didn't know that.
So do we have a list of situations like that so that the employees can see that, so that they don't go in there, they don't go blindly determining if it's going to be an emergency or not, so that at least they're well equipped with that information? Do we provide that to our employees? I don't know who I would ask on that one.
And if I could add the distinction, keep using the word ER. Let's look at an urgent health care versus an ER, because they're two different situations. How would an urgent health care facility look at the emergency situation?
If the member went to the urgent care facility, they would pay the urgent care copay at the urgent care facility. And then obviously when they go to the urgent care facility, if they deem it's an emergency, typically what would happen is they would probably call, if it was truly an emergent situation, they would call an ambulance to have them transported to a facility. And there are lists out there. I mean, I can pull one too, and I'd be glad to. I mean, we have some communication pieces for our clients that just talk about when to go to the ER, when not to go to the ER, when to use an urgent care facility, when not to use an urgent care facility, and that's something I'll make a note and be glad to send to staff.
But I think excellent questions. I think maybe there's an opportunity for HR staff to figure out a way to communicate some things better to our members, to our employees, so that way they kind of know when you're out of town. I mean, the last thing you want to do is just sort of casually get medical care that you may think is important at the time, and you may think it's an urgent situation, but may end up you may end up having to pay that out of pocket. So I think that's probably important that our members really understand the health plan that they have. So I think there's an opportunity there to improve the communication piece.
And I think it's important because while Valley Health Plans does offer an HMO plan, we are currently not under their HMO plan. We're under their PPO plan. So if you have a member that's on vacation in Florida and they just feel ill, they can call the customer service line, be given an in-network provider in Orlando, and they can access that member, pay their $25 copay, and receive meds while they're there, and walk into the CVS or the Walgreens and get meds. So we are under that plan right now, and that's what we're recommending we stay under. One of the options, the option to get the most savings, was if we moved into kind of the HMO, which is a little bit tighter. But the recommendation we're making is to stay in the PPO, and employees, if they're traveling abroad, as long as they see a member that's in the national network, they'll have access to the care.
Okay. Thank you, sir. And I guess my follow-up question or second question was on the $822,000 savings. Does it lose its identity where we can put that in our local account and we can put it wherever we want, or does it have to stay in the insurance?
It doesn't. I haven't read anything that it has to stay in the insurance. It could be used to improve insurance benefits or to reduce premium costs for future years. Since the employer paid into that plan, it belongs to the employer. Unless if you know anything different, Scott, as far as what we can do.
When your premiums, are you paying them just out of the general fund?
Yes, and different funds, federal funds as well.
Right. Okay. As long as You know, the only item I would say is if you had a trust that you had set up and you had money in there that you were funding and it was specifically a health trust, then I would think that you would have some concern there. But as long as the employees, as long as you are rebating their fair share that they've paid in, I think you're okay.
Right, so certainly our intent right now is to keep that separate. We understand as we go forward, there could be some additional premium increases. This could be something that we could use to offset some of that. So maybe what we can do is reserve it in our general fund, but reserve it for insurance purposes.
Dr. Flores?
Yes, let me clarify. That's a good thing. I mean, for those watching, I mean, I know some of the questions that are being asked, these are very good, solid questions, and I think they need to be asked. But I think those that are watching and as they see this replay, that's a good thing. I mean, there's a lot of districts that would love to be in a situation where we are tonight with regards to that rebate and in addition to a $1.1 million cost reduction from the last health plan. So just want to make sure that we throw that out, because, I mean, we can ask scenarios, we can communicate better, and we will do better. But at the same time, I mean, this is 76.5, medical loss ratio that I think, it speaks volumes to our employees and the whole community. So I just wanted to throw that out.
Absolutely. Mr. Chairman, go right ahead.
I would just like to follow that with my own observation. Thank you, Dr. Flores. I think we're in a remarkable position here, and I would like to acknowledge the work of our staff, and I'd also like to acknowledge the work of our employees. The only reason we're having this discussion right now is because of the significant efforts our employees have made. The medical loss ratio that we're discussing is due to their efforts and the efforts of our staff to assist all of our employees in working as hard as they possibly can to stay as healthy as we possibly can. And we all know that we get ill sometimes. I myself have, just out of the blue, and we deal with it the very best we can. So it's certainly not an indictment of any of our people who do become ill. But, I certainly want to applaud our staff, and our employees. We would not be having a discussion of consideration of a plan that brings cost reductions and increased benefits, and we would certainly not be talking about getting, near $1 million back from the federal government. This entire discussion is driven by the work of our faculty, and I'm very grateful for that, and we're very grateful for the acknowledgement of the insurance company in bringing that forward. So I think it's remarkable, Dr. Flores, you're correct.
Any further discussion?
Mr. Chairman, I want to thank, again, the committee, the participation we had in our committee meeting. Also, I want to say that I want to really thank the board for years back when we set a goal to improve health, fitness, and wellness for this district. And I remember when we had high medical loss ratio, well over 85% for years. And to be where we are now, it's been a team effort. We value our employees, the board does. We are in a good position right now. Fortunately, we are able to move forward with a shared vision. And I just want to say that the Employee Benefits Committee will be proactive in making sure that we engage our employees more effectively through the District Education Improvement Council, through Campus Council. We have focus group meetings with our employees. Though the survey that we got from our employees, 1,041 employees responded to the survey out of 2,400 approximately, and that's really a high return. We can improve that. We'll know from our employees who are the benefactors who use the service, and they'll tell us the experiences they're having. And we want to have that conversation. I'll lead that very proactively, and I ask my fellow board members to be engaged continuously about this, so that if there are issues, and Dr. Pettis here, who that's what he does day in and day out, course, they get to you early because people talk to you about situations. We know that we're in a good place, and I again appreciate your comments, and I also appreciate your support. And again, the people out there in the audience, people in the public, that we are improving with our health and wellness in this district. We need to do it not only with staff, but do it with students. We've got to model this kind of behavior that we want the others to follow. So thank you, Mr. Chairman. I think we've probably discussed this to the point that we can move forward.
So, Mr. McShann has called the question. So all those in favor signify by saying aye.
Aye.
Opposed, nay. Motion carries. Thank you very much.
Thank you.
Next item is approval of delegate and alternate for the 2012 TASB Delegate Assembly. At this point, I would ask for nominations for the delegate for the upcoming TASB Assembly, Delegate Assembly.
Make a motion for George McShann being the delegate for the 2012 TASB Delegate Assembly.
Second.
So he brings to the table a wealth of experience. There's a motion and a second. Did you call the question?
Second, yeah, I call the question, but for discussion?
You know, it's okay to railroad a past president of
Well,
TASB. I mean, my goodness.
Well, since we're in the discussion,
Make sure he got that out.
that was going to be my question. Is there a conflict because you're past president?
No, it'll be great, really, because we're going to have some tough issues, and I'm pleased to serve. Yes.
Do you just do you get more than one vote?
All those in there being no further discussion, all those in favor signify by saying aye.
Aye.
Hey, thank you. Now we need just in case Mr. McShann were to fall ill. Now he's not coming under the plan, so he would have to go to his own insurance company. So just in case he were to fall ill, and we need
Medicare also.
We need an alternate.
I nominate Jerry Fleury.
Second.
Moving second that Mrs. Fleury be the alternate. Any further discussion? All those in favor signify by saying aye.
Aye.
So we now have an alternate and a delegate and an alternate to the 2012 TASB Delegate Assembly. Thank you very much for your support of our members and of TASB. Moving on to administrative reports, the Facilities Committee report, Mr. Tapia.
Yes, thank you, Dr. Maldonado, members of the board, Dr. Flores. On August 7th, we had a Facilities Committee meeting. Board members present were Mr. Javier de Leon, Dr. Nolan Perez, and Mrs. Bernie Young. First item we talked about was a 3 to 4 year transition plan for the surveillance camera systems district-wide. Basically, we talked about transitioning from our current analog systems to a digital-based technology system. We discussed advantages and disadvantages of both systems and proposed costs and budgets. The other item we talked about was the delivery method of the Medical School Academy project, the creation of the design committee to keep moving forward on that, and also the status of the RFQs for the architectural firms, which the RFQs are due August 16th of this week. We discussed the bond program, the performing arts, 9th grade academy, and the ag farm are in the early stages of construction. We talked about that. We also talked about the Bogus Stadium work and the new memorial, which are in the completion phase. Both are targeted to get to substantial completion by the end of this week, and the certificate of occupancies from the city. We also talked about all the smaller renovation projects, South Kitchen, Vernon Band Hall, other classroom additions, and roofing and AC projects. We also updated the board on change orders that we've approved under the betterment allowances for certain projects, and Mr. Julio Cavazos discussed the construction funds. Are there any questions?
Are there any questions for Mr. Tapia? There being none, we move on to the next report, the Special Committee on Innovation and Technology. Dr. Cavazos.
Dr. Maldonado, Chairman, and board members, Dr. Flores, administrative staff, and audience. We first want to preface by saying that the dialogue at this committee meeting was, again, highly engaged, and so I want to recognize Dr. Maldonado and Dr. Flores for putting this committee together, special committee. We've gained a lot of traction on this. I'm going to give a brief overview, and then I'll turn it over to Dr. Perez, who chairs the committee. One of the items discussed was the proposed design committee for the School of Health profession. There was a lot of dialogue around that who would be members of the design committee. There will be an 11-member group that will steer the design of the School of Health Professions. 2 of those members would come from the community appointed by the Board of Trustees. Dr. Flores has since then sent an email requesting those persons be nominated and then will be reviewed by the chairman and Dr. Flores. The design committee charge was explained and reviewed at the special committee meeting, and one name was added as a resource, and that was Julio Cavazos from the business office. Following that presentation was an update on the dual language academies offered by Michelle Everett. We're well underway. We had an opportunity, all of us, to visit the training that was hosted at Means Elementary. Teachers are excited. The program is well underway, and I understand the slots are quickly filling up, and so we look forward to a celebration at both campuses, at Means and at Milam. We then followed with the next item, which was the results of the Student Technology Survey by campus. If you will recall, in the first meeting, we did a survey of all students grade 3 through 11, asking very specific questions with regards to technology and technology access. And so the results were presented by James Piercy, our Director of Technology, and those campuses with whose students had less access to technology were highlighted. There are plans underway for this data to guide our work and whether we need to extend our library hours at those communities to ensure that our stakeholders have access to technology and also access to the internet. Following that discussion and the review of the data, which we continue to report that it'll guide our work, was a review and a discussed proposal technology access plan for the 9th grade campus. So let me preface that by saying that the 9th grade campus is scheduled to open in August 2013. Early on in the year, this past year, a technology visioning committee was put together with members from across the district to bring forward a recommendation on how we would provide technology-rich access for our students at the 9th grade campus, which was our commitment during the bond election. And so Vivian Bauer, our principal, and James Piercy, our Director of Technology, came forth with a succinct presentation that can be sent to every board member that may not have been at the meeting, that was grounded on 2 pieces of work. One from Marzano entitled Using Technology with Classroom Instruction That Works, and then Empowering Students with Technology, the 2nd edition by Alan November. This information has guided the work as where we would end up with access for technology at the 9th grade campus. Both presenters brought forth a succinct presentation that spoke to the fact that it's what happens in the classroom instruction and the teaching and learning process that should drive the decision and where technology fits in the picture. And so there was a lot of discussion back and forth, all to say that the discussion centered whether the technology would be the focus or the instruction would be the focus, and using technology to enrich what was happening in the classrooms. And so both members were speaking on behalf of the committee, and they brought forth a discussion of a high access, bring your own device concept to the 9th grade campus, which, based on our technology survey, approximately 74% of our students that will be reporting to the 9th grade academy have access to a form of technology. The literature is now showing that we're moving away from the one-to-one, but more of a collaborative approach to teaching and learning, which is in sync with our project-based learning concept, which will be the model at the 9th grade campus. And so as the presentation went on, and Dr. Perez can elaborate, as the presentation went on, there was a lot of discussion about how we would ensure that all students had access to what was needed at the 9th grade campus. Our Julio Cavazos got excited when we said it was bring your own device, but it was not in lieu of technology being purchased for the ninth grade campus, but it was going to be a model that provided for both bringing devices from home and also providing access. Again, the technology survey has provided a lot of information to us that has guided our work, and it allows us to really plan in accordance. One of the comments was, we're not opening until August 2013. Here we are presenting a year in advance almost. That was by intent. There's a lot of work that goes into rolling out a responsible plan that ensures that technology does not take center stage, but in fact, it's a teaching and learning that takes place in the classroom, and the technology facilitates that and engages the students to a greater degree. Last item was future topics for discussion. There was a question as to, a proposed item for trying to figure out where we are in transitioning the teacher role to that of a facilitator rather than a sage on a stage, and project-based learning, how much traction that has taken. And so we're working that piece to determine how close we are to that mark, especially with the ninth grade campuses opening. And so I do want to, before I turn it over to Dr. Perez, say that all of the presenters, in particular Vivian Bauer and James Piercy, did an exceptional job at the meeting and presented great information that will continue to set the tone and the direction for these projects. And so I turn it over to our chair of the special committee, Dr. Perez.
Well, Dr. Cavazos, first I want to applaud you for obviously the preparation and the work you put into this committee meeting. I think it was this very productive meeting. I think unfortunately we stayed a little bit late in the evening for a committee meetings. Hopefully that won't happen again. So, but I do think, and several board members were there. I know Mr. McShane, I think you were out, but I know that Verna Young was there, and Javier. Unfortunately, summer's tough, and not everybody could make it. I certainly hope that all the board members would come, because it was certainly an engaging discussion. And I do applaud also James Piercy, the work you put in, and Mrs. Bauer, incredible presentations. What really impressed me the most was that, we really focused, and it all was about maximizing student learning. And that was the focus. And so I thought the presentations were excellent. I think the discussion was even more amazing. And sort of, I really view the committee's work as sort of continue to being a catalyst for our continued transformation. Very exciting. I hope all the board members get a chance to come to the future committee meetings. And certainly, I think that we'll continue to see what staff is working on lately in terms of the transformation as we continue to move towards optimal learning organization to prepare our kids for the 21st century in this new digital global world. So very exciting stuff. I can't wait for the next agenda for the next meeting. But again, I applaud staff's efforts, Dr. Flores, Dr. Cavazos, and everybody in attendance. And hopefully the board will be all the board will be there next time. So thank you, Mr. President.
Thank you for those comments. The next item is monthly tax collection information. Mr. Goss.
Thank you, Dr. Manuel, Dr. Flores. Agenda item 18 is here, the monthly tax collection report for the month ended July 31st, 2012. If you look at the center of the page, we had collected about $36.7 million in property taxes. That's about 99.8% of the total levy. Compared that to last year, $36.6 million, which is about 100% of the total levy. So pretty comparable to last year, and pleased with the services, collection services. We probably will be at 100% before the end of the year. Any questions on that?
Are there any questions for Mr. Casas? If not under that item, then we'll move on to monthly financials. Mr. Casas.
Thank you, Dr. Mal, Dr. Flores, board members. Agenda item 18D are the monthly financials for the month ended July 31st, 2012. You do have your balance sheet and income statement for the general fund, food service fund, and debt service fund. General fund, we're anticipating, and this is through July 31st, but projected through August 31st, projecting to have a fund balance of about $35.7 million in our general fund balance. In the food service fund, we have about $2 million fund balance, and our debt service fund currently at $8.3 million. Debt service fund is going to change because we still need to have the debt service payment, for August. So we're going to end up probably about $600,000 fund balance there. Any questions on any of that?
Any questions from Mr. Cavazos on the monthly financials?
Can you remind, Mr. Mr. President. Can you remind me, when are we formally approving budget?
We actually have that's a good question, Dr. Pettis. We actually have a public hearing August the 27th, which is a week from Monday. Our budget and tax notice should come out in the paper on this Friday. Yeah, I think this Friday. It should come out on the budget Thursday. And that's required to post in the newspaper at least 10 days prior to have the meeting. So our intention is to bring forward the completed budget for approval to the board on August 27th.
Thank you. Thank you.
Mr. Cavazos, the next item, certified tax roll, certified tax collection rate, and tax collection information.
Thank you, Dr. Flores. We're bringing forward to the board the information that we received from the appraisal district. If we flip over a couple of pages there, the total certified values from the appraisal district, the total market value, $3.9 billion, total approved taxable value, $3.2 million. There's still some market value that is under ARB review, about $41 million. That is about a 6.2% increase in taxable value over last year, which is pretty good. We hadn't shown any increase the last 2 years, so we're pleased with that information. Any questions on any of that?
Any questions from Mr. Cavazos on the tax rolls? There being none, we move on to the next item. It's adjournment to close executive session pursuant to Texas Government Code Sections 551.071, 551.072, 551.074, and 551.082, the Open Meetings Act, for the following purposes: discussion of Level 4 grievance, RL, discuss employment of assistant principal at Harlingen High School, discuss employment of principal at Houston Elementary School, discuss employment of principal at Long Elementary School, discuss employment of assistant principal at Dishman Elementary School, discuss employment of teachers and other professionals. The board will now enter executive session. To take action on a matter discussed in executive session. First item is a grievance level, consideration of a level 4 grievance by RL. It's a desire of the board.
I move we table the item.
Second.
Move in seconded that the item be tabled. Any further discussion? All those in favor say aye.
Aye.
Opposed, nay. Next item is consider employment of assistant principal at Harlingen High School South. It's a desire of the board.
Approval as recommended by the administration.
Second.
Moving second, any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, nay. Motion carries. The next item is to consider employment of principal at Houston Elementary.
I move to approve the employment of principal for, at Houston Elementary as recommended by the administration.
Second.
Moving second, any further discussion? There being none, all those in favor say aye.
Aye.
Opposed, nay. Motion carries. Next item is consider employment of principal at Long Elementary School. It's a desire of the board.
Make a motion for approval as recommended by administration.
Second.
Moving second, any further discussion? All those, there being none, all those in favor of the approval as moved signify by saying aye.
Aye.
Opposed, nay. Motion carries. Next item, consider employment of assistant principal at Dishman Elementary School. What's the desire of the board?
Move approval as recommended by the administration.
Second.
Moving second, any further discussion? There being none, all those in favor signify by saying aye.
Aye.
Opposed, nay. Motion carries. Next item is consider employment of teachers and other professional staff. What's the desire of the board?
I move approval as recommended by staff.
Moving second, any further discussion? Those in favor say aye.
Aye.
Those opposed, nay. Motion carries. Meeting is adjourned. It's approximately 8:55.